Sadism and Masochism, when pleasure becomes pain. There are moments when human emotions deviate from the familiar path of affection, compassion, and natural intimacy, slipping instead into a strange realm where pleasure is inseparable from pain. A realm where the cries of agony are not a call for help, but a source of thrill and ecstasy. This is not the imagination of a horror writer, but a deeply rooted psychological phenomenon known as sadomasochism, or, more specifically, sadism and masochism. Sadism refers to the tendency to derive pleasure, particularly sexual pleasure, from inflicting pain, humiliation, or suffering upon others. Meanwhile, masochism is its mirror image, the desire to experience pleasure through receiving pain, submission, or humiliation. These two sides of the same coin often intertwine in one person or between two individuals, creating a dynamic of domination and surrender, violence and submission. But where did this behavior originate? Is it merely a deviation, or is it an illness? And what does science, psychology, and faith say about it? Let us begin with the psychological perspective. Sadism and masochism are classified under the umbrella of paraphilic disorders, meaning atypical sexual behaviors that may involve harm to oneself or others. These disorders often begin to manifest during adolescence or even earlier, usually due to a complex interplay of childhood trauma, emotional neglect, or experiences of abuse. The victim sometimes becomes the executioner, or continues to seek the same suffering, as a subconscious attempt to re-experience and control earlier traumas. Some sadists have a history of being oppressed, humiliated, or ignored during childhood, leading them to seek empowerment through inflicting pain on others. On the other hand, some masochists find safety in surrender, associating pain with affection due to an early upbringing where love was coupled with harshness or control. From a neurological point of view, studies have shown that certain areas in the brain, like the prefrontal cortex and limbic system, play a role in modulating pain and pleasure. In some individuals with sadomasochistic tendencies, these regions may process pain as a form of pleasure due to altered neural circuits or dopamine responses. Despite this, sadomasochism is not considered a disorder per se, unless it causes significant distress, impairs daily functioning, or involves non-consensual acts. In therapeutic terms, the most concerning cases are those involving violence, coercion, or psychological harm. In the realm of ethics and religion, these practices are viewed through a different lens. Islam, for instance, emphasizes dignity, compassion, and the sanctity of the human body. Any act that involves humiliation, harm, or degradation contradicts the values of mercy and respect between spouses. The Prophet Muhammad, peace be upon him, taught that intimacy is an act of love and tenderness, not a place for cruelty or submission to base desires. Faith calls us to elevate our souls above the slavery of urges. It teaches us that true intimacy is built upon emotional connection, affection, and tranquility, not pain, humiliation, or psychological wounds. On the social level, sadomasochism has begun to appear more openly in media and entertainment, which has contributed to its normalization in some circles. However, the danger lies in blurring the line between fantasy and psychological harm, between consent and abuse. Behind the masks and scenes of dominance, there are often unhealed wounds, unmet emotional needs, and souls in pain. Many therapists who work with individuals exhibiting these tendencies aim to treat the root causes, trauma, insecurity, abandonment, rather than merely addressing the outward behavior. Healing requires understanding, support, and sometimes professional intervention. There is a need to ask, is this really pleasure, or is it a cry hidden behind the disguise of desire? Are these acts expressions of freedom and identity, or chains of pain inherited from a dark past? In conclusion, sadism and masochism are not just odd behaviors. They are manifestations of deeper psychological struggles, wounded hearts, and misguided attempts to regain control. Science reveals the mechanics, psychology explains the motivations, and faith restores balance and healing. Let us always remember, true love is never violent, and true pleasure is never born of pain. If you enjoyed the video, don't forget to like, share it with your friends, leave a comment, and subscribe to the channel to get our latest videos.